Hi everyone, this is Dr. Stefan. In this video I'd like to answer a comment that I received on my channel about sarcoidosis treatment. It's a very good comment. I won't read the full comment, but basically the gist of it was whether someone who has sarcoidosis would require steroid treatment or whether we can use something else, some other treatment, because obviously people are worried about steroids giving them side effects and things like that. So first of all, I'm not your doctor, so please talk to your healthcare provider about your own situation because in sarcoidosis there are actually a lot of nuances to treatment and not everyone requires treatment. So I'll say that again, not everyone who has sarcoidosis actually needs treatment, and that's a decision that you will make together with your healthcare providers depending on your scan results, your blood tests, your lung function tests. All these things play a role. Your symptoms, everything plays a role into making this decision whether you should embark on treatment or not. That's really important to begin with. Now, who may need treatment? This is again a combination of factors. Generally, if your symptoms are very, very significant, so if you're struggling with the sarcoidosis symptoms, it may be a problem. You may ask for the treatment yourself because your quality of life is severely impaired, and that's one indication for potentially starting steroid treatment or something else. The other thing that's really important is whether one of your vital organs is affected, because sarcoidosis can affect many organs of the body at the same time. So if your heart, for example, is affected, if your nervous system is affected, if there's significant liver disease, if your lungs are very, very inflamed and there's a high chance that you might develop lung scarring because of that, which can be irreversible, then your doctors may recommend treatment. So there are life-threatening situations where you may need the treatment. The other thing would be whether you have very high calcium levels in your bloodstream. That's also, again, a dangerous situation that may require intervention with treatment. And your healthcare team will make a recommendation based on a combination of all these factors and what's the sarcoidosis form in your situation. So what is going on in your case? That's really important. Now, if you start treatment, usually it's correct that you would start with corticosteroids, such as Prednisolone. Now, this is usually started at a moderate to high dose, and then the dose is reduced progressively over time to the minimal dose that's required to control whatever's going on, whether it's organ involvement, whether the symptoms are too severe. So we're trying to reduce the steroids to the safest, lowest dose. Now, that may take a long time, so you may have to be on a steroid treatment for up to a year or more. And that's why people avoid starting treatment unless they have to. But what may happen after that period is that you may be feeling really good. Everything, all the blood tests, all the results are great. So you may continue to reduce the steroids gradually. Don't ever stop them suddenly. That's really important. Talk to your doctor about making sudden changes to prednisolone or corticosteroid treatments because that can be dangerous in itself. So you would then try to reduce them to zero slowly over time, and sometimes that works well. Sarcoidosis doesn't come back. It may come back a few years later. You may start the same process again, a little bit of steroid, wean it down slowly, and everything is controlled. Now, that is the most common scenario. It may be that you get some side effects. You may get a bit of weight gain. You may need to be a bit more careful while you're on the steroid treatment. There's a higher risk of getting high blood pressure, diabetes, so you may need to be monitored for that. But that's usually the first line treatment. Now, coming to the question from the video. If you do need another treatment, if you don't tolerate the steroids well, and some people don't, there are steroid-sparing drugs. So this is the second line treatment for sarcoidosis. Now, usually you would be on a low dose of steroids. It's working or it's not working so well, and we reintroduce a second medication. This could be methotrexate, it could be azathioprine, maybe in some cases hydroxychloroquine or something else that your treatment team will recommend. And we introduce both drugs and then we reduce the steroids slowly and you are kept on one drug only. That's steroid-sparing drug. Now, that one is not free of side effects either. Generally, these are immunosuppressant medications which reduce your immune response. You may be more prone to infections. There's quite a lot of things that you need to be counseled for even if you go on a different treatment that's not steroids. Now, steroids, and here I mean corticosteroids, so they're not anabolic steroids or anything else. So things like prednisolone, these things are actually very predictable in their side effects. So that's why they're the first line treatment. Even though you may feel that the side effects are unbearable and difficult, they're very easy to predict. With the other ones, it's less so. And you do require some monitoring for your blood cell levels and things like that, liver function tests. etc. So you're not free of monitoring if you go on a different treatment compared to the steroids. But it can be helpful. So if you're struggling with sarcoidosis, you need high doses of steroids, you're getting a lot of side effects, usually a second drug is added on, and you're trying to have both drugs for a while and then reduce the steroids, drop them down, preferably to stop them completely, be left on another drug that gives you less of the side effects. But this is generally how it works. We don't just start you on something else. It can be done in some cases, but I think there needs to be a very strong contraindication for starting the steroids, which are the most predictable treatment, like I said. But it's important to try to avoid treatment if we can. So if you don't need the treatment for the sarcoid, we try not to start it because, like I said, it can last for a long time. 12 months, 18 months, and you can develop some side effects. But it's important to balance the risks of the sarcoid disease, how bad it can be, versus the risks of the drug. And if the benefit of the drug outweighs the risks of the sarcoid, then maybe that's the right thing to do. But it's a nuanced decision, so I do urge you to talk to your healthcare provider about whether you would require such a treatment. It's very hard to answer in your case, but do drop some comments in the comment section below, and I'll try to make future videos to try to explain the nuances a little bit better. Thank you very much for watching, and all the best and good health.